Well, for more on what frontline workers are going through during this pandemic, I'm joined live via Skype by clinical psychologist Cassiday. Welcome to the show.
Thank you very much. It's good to be here.
Thank you. I mean, clearly this is a lot. These people are caring for patients while putting their own health and their families at risk, and another wave of COVID that's breaking records already. How are healthcare workers doing right now?
I think they're struggling. What's difficult is, in the United States, people are used to having an unlimited supply of health care, of the things they want, or being able to offer every patient everything they need. And that's not the case now with the pandemic. And the other thing that's very difficult is that unless you're a medical person who's trained in hospice care, you aren't given the mental health resources to deal with the kind of situations that direct care workers are with all these COVID patients who are dying and families who are frantic. And, that very painful example that the previous interviewee was explaining is something that's very hard to manage if you haven't been prepared for it. And so we are seeing a lot of anxiety and depression amongst direct care medical workers. We're seeing burnout. We're seeing people having post-traumatic reactions. It's a very difficult time for them.
So what are some of the long-term consequences that come with this sort of exposure?
Well, I think, the dilemma for many people is if they don't get the mental health care they need, then one of the long-term mental health consequences is having chronic anxiety and depression. And PTSD-like disorders. Another problem that we're starting to see is cynicism and professional burnout, where someone's feeling like their efforts don't matter, they aren't accomplishing anything. And what we see is, especially if you feel like the administration of your facility or your practice or the government is not behind you and not supporting you, and recognizing the important role you play, then you increase the odds for burnout. And unfortunately, in our country, we've had a very confusing situation and confusing messages coming from our government. And then, different responses from different states. I live in one state where the governor was not allowed to order masks, and I work in another state where the entire state joined together in insisting that masks be worn, and they're experiencing a very different health outcome right now, and that really frustrates doctors and nurses.
So then to that point then, I mean, I know when all of this started, we saw medical workers were saying, look, our basic equipment needs aren't being met. They were either reusing PPE or having to make their own. What's the case now?
Well, we see that it's not as bad as it was at the start, but people are still having to be careful, and it's both being told to exercise caution. So we do have some areas, particularly if it's more rural and they were incredibly unprepared for the upsurge in cases where they're running out of supplies and having to wait, or we have other areas where it's very busy and they don't have a secure supply chain. And that creates anxiety and stress, and it also creates resentment against, the authorities who they feel like are not paying attention to the needs of the health of the nation.
So then what needs to happen to ensure that the proper supplies get to where they need to during this pandemic?
Well, I think one thing that I hear from many doctors and nurses is they wish that government and hospital management would listen to them and listen to what they're saying is needed, and helping them set up the plan. And they feel like one thing that didn't happen early in this pandemic was the scientific experts, the medical experts were not listened to, they were ignored, or their information was suppressed. And that is the pain that I see so many doctors and nurses going through, is the feeling that we could have prevented this and we didn't. And now it's happening again, and we're not as prepared as we should be.
And as you mentioned, with cases on the rise again, we're seeing these hospitals and these ICUs filling up. Firstly, is there enough staff to meet the increase in patients, given the number of people who are either leaving or leaving sick? And is there enough money to properly compensate them while covering these extra costs like PPE and vaccine readiness?
Well, it's not clear. One thing that is very true is we know that most hospital systems are for-profit institutions. And so many healthcare workers are aware of that and thinking they should be able to fund this. And so you have, sort of competition between the stakeholders for profit versus the people who are working there. And then there's the same feeling about the government, in terms of what they're supplying and what they're willing to do. And so one thing that's very difficult for anyone to tell is what exactly are the resources of the nation and how can it be funded? And many people, of course, are saying, well, if we chose not to fund certain things that aren't high priority right now, of course we could fund this. But we don't have a well-developed socialized medical system. A lot of it is for profit, and that is a problem.